Hello, it's Suzy from Active Seniors here with another quick exercise tip for you. Now today's tip is specific to any women who have had breast cancer and may have had to have a mastectomy or some lymph nodes removed. They might find that afterwards the shoulder on the involved side feels a little bit stiff or restricted in its movement, and you might notice that the fluid in that side tends to build up a little bit more as well. So this exercise is really targeting both of those aspects. So what we're going to do, all you need for it is a dowel or alternatively a broomstick. Anything like that can be really useful. You're going to lie down. Now I'm going to lie on the floor here, but I'd recommend that it's probably better if you lie on your bed and that you have your side, so that if affected shoulder close to the edge of the bed, so that if you need to, you can go a little bit lower than the ground or than the bed height. Okay? So with this, there are a couple of key things. The first being that we're choosing this up position because as I have my arm up like so, or in various positions, it makes it much easier for any fluid to drain back down into circulation. When I'm standing up and I've got my arms by my side, or even if I'm bringing my arm up in front, because gravity is pushing and creating resistance, it does increase the pressure that is needed to overcome that resistance. Okay, so being in this position here will really help it. Second of all, what we're going to do is we're going to move into a position. So we're going to use this hand here, which is my non-affected, and imagine that this is my affected hand. I'm going to just gently push into a stretch. Okay, and then when I start to feel a stretch, I'm going to hold this position here for about 30 seconds. And then I'm going to use the affected side to gently push back, and I'm going to use my non-affected side to counter that. So in essence, I'm squeezing both ends of the broomstick or the dowel, and I'm getting a light contraction of the muscles in and around this shoulder and chest area here. I'm going to hold that contraction for about 10 seconds, and then I'm going to relax. And I'm making sure that I'm not holding my breath throughout any of this exercise. And then I'm just going to gently see if I can go a little bit further. Now, obviously, I'm going to be restricted today by the floor and also by the length of the dowel. But if you're doing this at home on your bed, you'll be much easier. So you can do it in different positions, okay? Out to the side, at diagonals. You choose wherever it feels stiff. But just remember, this position, arm overhead, is really good for helping to remove that fluid. And second of all, a stretch first for a short period, and then that light isometric contraction, so gentle pushback, resisted by the other hand, to try and really activate those muscles in the area, does help most with flexibility. I hope you've enjoyed today's tip. Stay safe, stay active, and we'll see you very shortly for another exercise tip. Bye for now.